Diabetes. It is such a demanding disease that can affect your life in so many ways. Just as what actor John Regala experienced with his battle with this common condition.
Social media ngayong linggo lang ang litratong ito na sinasabing si John Regala raw. Na sa pagkakataong ito, tila walang kalaban-labang nakahandusay sa labas lang ng isang supermarket sa Cavite. Namumutla at parang walang malay. Suspetsa niya, bumaba ang kanyang sugar level dahil sa kanyang diabetes.
Diferensya natin, diabetes, ano. Siyempre, may mga pangontra namang gamot yan.
Diabetes can lead to serious diseases that can affect many organs of your body, leading to blindness, heart disease, kidney failure, lower limb amputation, and even stroke. Although you have medications to manage your blood sugar and you try to change your diet, this is not enough. So watch until the end of this video to know more about the benefits and importance of exercise for you or a loved one who has diabetes.
Hello to everyone. I hope that you're all doing good. This is again Doc Sherry, Doctor of Physical Therapy. Are you diabetic? Actually, diabetes is a very common condition worldwide. In fact, the International Federation of Diabetes already mentioned that there are over 364 million people diagnosed with diabetes. Sadly though, this patient population group is also more predisposed to having coronavirus infection, which is increasing worldwide. Consistent exercise is really overlooked by most diabetic patients. May you be taking metformin, either you have your insulin injections, you are undergoing dialysis, or even if you are a candidate for kidney transplant. This may be because you are too lazy to exercise, you are afraid to exercise because of hypoglycemia or low blood sugar, or you were told not to exercise. However, my friends, the American Diabetes Association makes their firm stand that patients diagnosed with diabetes should exercise regularly because the effects of not exercising is way bigger than its risk. The importance of exercise together with your medication and your diet of whole and processed food should never be underestimated. If you're new here to my channel, please click the subscribe and the bell button so you will be updated with my weekly uploads. Also, please feel free to type in Doc Sherry in YouTube where you can access my playlist and you will have free relaxing healing music videos that will promote relaxation and will promote better sleep.
Here are the benefits that you get if you exercise regularly and in moderate levels. Your insulin medication will work better. Insulin sensitivity is increased when you exercise. A 30-minute of exercise will increase your insulin sensitivity for at least 48 hours even after you are done with your exercise, which is good because high insulin sensitivity allows the cells in your body to use blood glucose more effectively, reducing your blood sugar. You will have a healthier heart since one of the most serious complications of diabetes is its effect in your heart. It will lower your blood pressure, especially if you are hypertensive. Your immune system ability to ward off virus and bacteria will be better. You will improve your cholesterol level, which is usually high in diabetic patients. You will experience increased energy and endurance throughout the day because when your muscles contract during your exercise, your cells are able to take up glucose and use it for energy whether insulin is available or not. You will have better sleep at night. You will have stronger bones that will prevent your bones from breaking, and you will lower stress, anxiety, and depression, which is also very common among diabetic patients. What single medication can give you all those benefits? None. Only exercise can, and it's for free. As stated by Dr. Robert N. Butler, if exercise were a pill, it would be the most beneficial and most prescribed medication worldwide. I couldn't agree more. Now, when should you exercise? Exercise 1 hour after your large meal. If you took breakfast at 8 a.m., start your exercise by 9 a.m. or onwards. Do not do your exercises during hot times of the day to prevent heat stroke, and do not exercise 1 hour before you sleep. Do your exercise at least 30 minutes 3 times a week, and do it in non-continuous days. So for example, you can do it Monday, Wednesday, and Friday, or do it Tuesday, Thursday, and Saturday. You need to exercise 3 times a week a minimum for you to see the results and benefits of your exercise. You are not advised to have more than 2 days in a row without physical activity. Now you might be wondering, how would you know if you are not overdoing your exercise? When you exercise, see to it that your breathing should not be so hard that you cannot talk with someone while you're exercising. If you have somebody with you in the house, exercise together with them to make it more fun and for you to have somebody if just in case you need help. You should not feel extreme muscle soreness the following day. If you would, slow down on your next exercise. Start out your exercise slowly, then progress to a comfortable pace for you, and then slow down again when you are about to finish. You should stop your exercise if you find it difficult to breathe. A slight shortness of breath during exercise is normal, but laboring to catch your breath is not, and you need to stop. Stop if you have chest pain, radiating arm pain, if your skin turns cold, if you have excessive sweating, if you have a BP monitor and your BP reading is greater than 200 over 110, and if you counted your heart rate and it is 120 beats per minute. Here are helpful tips that you can do. Always have a pack of biscuit, orange juice, or candy available just in case you feel hungry, dizzy, if you find it difficult to concentrate, or if you notice trembling, since this can be symptoms of hypoglycemia. This is the safest action because this can relieve hypoglycemia and cannot harm you if ever what you have is the opposite, which is hyperglycemia or high blood sugar. If you have type 1 diabetes, never exercise during the peak times of insulin, which is 2 to 3 hours after you had your insulin injection. Always wear proper footwear to prevent any cuts and damage to your skin. Drink water before, during, and after your exercise. Drinking water helps to rehydrate your blood when the body tries to remove excess sugar through your urine. And if your blood sugar is lower than 100 milligrams per DL or 5.6 millimoles per liter, eat carbohydrate first and then recheck your blood sugar after 15 minutes. If your number will be greater than this, you can start your exercise. You can also keep a log and record your blood sugar level before and after your exercise. It is not true that all patients need to undergo an exercise stress test before exercising, but it is not a bad idea if you have issues with your heart. If you follow the recommendations in this video, the aerobic and strengthening exercises recommended here would be too conservative to require an exercise stress test. You might be wondering, what are the exercises that are best for you? Studies have shown that a combination of aerobic and strengthening exercises can help you achieve the benefits that I have taught you a while ago. You can do at least 30 minutes of moderate walking, swimming, or jogging at least 3 times a week. If you have a treadmill at home, use it. These activities would allow you to move large muscles in your body and would increase your heart rate. You also need to do strengthening exercises using weights or resistance bands. You need to do this 3 times a week. If you don't know how to do it, do these simple strengthening exercises with me, which will already target all the muscles in your body.
Thank you very much for watching. As far as your aerobic exercise is concerned, you can just walk around your neighborhood or walk around your garden, or if you have a treadmill at home, please feel free to use it. Should you need properly progressed treatment, please contact any licensed physical therapist near you. Should you have any questions regarding diabetes or exercises suited for diabetic patients, please feel free to comment down below and I will surely get back on you. This is again Doc Cherry. Stay healthy and God bless you.